Okay, anyways, thanks for the opportunity to presentations, and then we would like to thanks for company work and obtaining a result using SMC Pro, that is a saliva can detect to COVID-19 diagnosis. I found that since that there is a relationship between the expression level of the IgG and the cytokines in the blood and saliva, would you like to present the possibility diagnosis with using the salivas? And then today, I would like to emphasizing that result our studies allow the simultaneously analysis COVID-19 diagnosis and the vaccination status. Even not its complete data, but I found that the possibility. That's why my title is Diagnosis and Monitoring SARS-CoV-2 Progressions by IgG Cytokines and the microbiomes profiling in patient salivas. And the content and looks at the introductions, material method and result discussions, and we further analysis. Because we're not finished that complete yet. So first ideas and the first idea is then COVID-19 is basically infect in the saliva, and I'm sorry, the mouse. And then most people found that gingiva and the salivary gland, they express as AC2 and the other, COVID-19 receptors. So that is to infect, and then they move to throat, and then they move to lung, and then they causing the severity. And this data we do, and then the IgG levels, and then the first infections they increase the IgM, and later on they increase IgG, and they combine together, they highly express in all various cytokine sort of things. Their ideas, I can choose that instrument is SMC Pro and Luminex. Luminex means with multiplexing, we cannot pick it up the certain cytokines, so we just 37 plex, and we're using to determine the COVID-19 relations. And many people say that COVID-19 can detect in saliva, and then one of the issues, New England Journal, I found that the papers, and then they swapping the data and collecting the saliva, there is very close relationship between each other. And then depending on person, they have the infection rate is the increase or decrease. They show all the data. That based on that ideas, we can possible to kind of our hypothesis can prove in saliva. That's why we do. Introduction that I mentioned that a little earlier that saliva is a kind that is saliva detections. I'm sorry that the COVID-19 infects the mouse, and then how they transmit to other people. Then we say that kind of saliva droplet, and then so if you have the high levels in the COVID-19 or the COVID IgG levels, and then there is kind of the potential people to infect and COVID-19. And so with that kind of background, in this study, we examined the level of the IgG against the SARS-CoV-2 in whose testing the positive or vaccinated. And then comparisons made with the health control, and we can determine to SARS-CoV infections, even the asymptomatic people. And basically we got the IRB, and then we we do assays that 96 patients and who is infected by COVID-19, and 56 people is volunteers, and 95 people in the receiving the first vaccination. And so the SARS-CoV detections that is performed in the hospital. And we got the hospital data and the RBD, IgG detections we're using the PDXen Co, and multiplexing we're using Luminex. And then microbiome data, and we got 16 target sequencing. And then we try to the statistical analysis. And clinical parameters we can get like this. At all times they're measuring the CRP and IL-6 levels and LDH. Okay, so that is our result. And in that black colors, they indicate that the IgG level. And that patients and the serially we collect that serum and the IgG levels going down. And if there is no IgG, means kind of that COVID-19 free because they are out of the hospital. And later on, after 20 and then 40 days, they still in the hospital, means they got severe patients. And then next pictures, and then we can the red colors in we test in the serums, and then we test the salivas, and then pattern is very similar, but the level is a little different because the serum is more increased that only increased the IgG, but the serum is later on. But when you remain the COVID-19, they still higher levels is IgG. We found that, and then we set analysis that is the serum in saliva, whatever you measure in each samples, and then data is I mean they have the relationship between each other. So next one is actually that we have to test the families because they have to combine all together, and then father and mothers and one sister and the second daughters. We measure the second daughters have vaccinated because if they have vaccinated, we found this high levels of IgG, and the father, mother, and sisters there is no vaccinations. The COVID-19 is free. That's why the IgG level is below. And then that's the features we test to before and vaccinate, and in the middle of first vaccination, and the second vaccination that someone got, and we collecting that, we see finding that most people they have carry over that IgG. We found that. And we have also some data, and the vaccine is non-vaccinations, the IgG level is clearly different. For statistical analysis, we got below that 0.001. And the other one is, so we checked that RBD IgG is what about in different populations that disease, baseline have disease. The first vaccination level, when it compares to normal, the first population is the ankylospondylitis because there is that, systematic immune system, that problem. And then dementia, that is only older people. And the Crohn's disease, and we checked that. But dementia in the Crohn's disease is a little bit higher because I published all the papers that COVID-19 can infect the intestinal. They causing some factors. So we don't know. But when I compare the ankylospondylitis and the Crohn's disease dementia, their level is a little bit higher than ankylospondylitis. This is another data. Okay, the unknown population means we don't know who is vaccinated, who is not vaccinated. But we found that only 2 people, and after 14 days, they suddenly increased the IgG, and then we asked them, they do not have vaccinated. that means they possibly infected persons without the symptoms. So we can ask them, they go to the PCR diagnosis, but they didn't. So we don't know yet, but they maybe with that possibility. The other population receiving the first vaccinations and the 0 days, that means after vaccination, after weeks, we collect the saliva. After 14 days, we collect the saliva again. And then only one person dramatically, level is very lower. That means I asked them, you got this data, and they say that, I'm ready to the second vaccination. So we can check that person's again later. The next slide, and then what about that cytokine level that what are patterns they showing to that issues that the first infections, there's the asymptomatic, there's the cytokines, they're very diverse, and then the level is that changes. But we found that late one, that some cytokine collected. The other ones, we can check the saliva and the serum, and compared to that, and the serum is very diverse. It's very big, but serum is very highly concentrated. They closely related to each other. So that means we can chance to examine that the level of cytokines might be, we can check that the progression of the SARS-CoV-2 infections and during the treatment. Next slide, we see that individual cytokines during with this data, so we measure in the serums, and we found that very serious patients, they still increase that the first one, and then if you see that after 20 days, the certain point is increased. The other one is as soon as upon infect the COVID-19, and they increase cytokine, but it's always decreased in the basal level. And this is one of the issues of that one patient that we collected serial samples, so we can change to how they cytokines up and down, and then usually they increase the level, and then they level down. Some cytokines they increase. So this data, we more collecting the data, we need more analysis. This one is that one of the green colors, red colors, severe persons, and then green colors, we thought that after infections, they have the asymptomatic, but some symptoms, very mild symptoms, and they go hospital, and then they out of hospital after 14 days or 21 days. And the senior persons, they look like in the serum, they cannot see that difference, but saliva, so we can see there's some difference. So when detecting cytokine, sometimes get more information from the saliva than in the serum. And then we still found that COVID-19 that is a presence and absence means some people go hospital and at treatment and go out of hospital, then it's free. Means after finish that persons, we compare the data, but we cannot find any statistical significance in the serums for saliva. We found that the main is if I free and COVID-19 means we can, even though they do PCR, but we can also check that the saliva cytokines, and then we can decide. It's very because we didn't get this more data, so it's very hard to explain. this is same, and that is in the serum because these cytokines and all of the literature say that it's very important. The cytokines it impacts, COVID-19, and then the cytokines increase. But when I'm measuring the serum, we cannot detect that the highly difference between two groups. But when you pick it up the salivas, we can have that MCP3, the typical that is a significant statistical analysis. We found that that one, and then our performance. Why are we doing that? And then if you have that population, so which there is just blind test means we can select 3 different people, which is one is that very low levels IgG is free, even they don't have the vaccinations. But some people, they have that highly IgG, and we can find that the vaccinations. And the other one, people, if you the high level of IgG and also high levels in cytokines, we can select the SARS-CoV-2 infections, even they have vaccines or not. Also, so we still undergoing that investigations right now. But why old people very easy to infect by COVID-19, and we check the microbiome, and when you infect the microbiomes, and the certain microbiomes very highly increase when it compared to normal, but depending on this is age. We have the age matchings or that same conditions, and then but so far we got data means younger people's data change around that oral microbiomes, but the old people's infect one of the infect is change to oral microbiomes. Sorry, and that data is we still undergoing that exam. These questions that I very shortly say that if you use the saliva, it's very attractive because when you're collecting the blood, it's very difficult. But the saliva, they just give them one bottle and then spit that saliva and give us we collect them all one, and then we check that RBD IgG and then cytokines and the microbiome test, and then we can expect that they are infect or the vaccination, we can discriminations. So very easy. The currently we measuring IgG cytokine associate the salivas and determine there is a status of vaccinations, or even though they receive the vaccines, but they cannot find the IgG. That one is we got that information. This is very important. The validation and the serial measurement, and then we are nursing hospital, and we collected 250. Actually, there's more than 250 samples we got. And then if you serially checking that, we might be testing that 1,000. And then we open it up, and anybody want to test that status of the IgG level after vaccination. And then we collecting the 500, around 500 people. And the volunteers who says, now I don't have the vaccinations, but I don't want to check that my IgG. And then we might be checking they are the infect or not. Basically, the symptom is to go to hospital, but we are focusing on the asymptomatic populations. And then, yeah, that is we got some more precisely we can get the conclusions, but so far we can say that salivas can detect that COVID infections, COVID infection and that vaccinations against SARS-CoV-2. Thank you for the sending, and thank you for the listening to our presentation.